Audio Jungle.
Dear viewers, welcome to our webinar this evening on improving capacity to address gender-based violence in Kenya, a cross-sectoral conversation about achieving justice. Please keep in mind that this webinar is being recorded. You're welcome to submit your questions using the Q&A feature at the bottom of your screen. The Q&A feature will take place at the end of this session. The features that are disabled in this webinar are audio and video sharing, as well as screen share. I would now like to hand over to the Director of Columbia Global Centers, Dr. Murugi Dirango.
Thank you, Pauline. Good morning and good afternoon to our global audience, and welcome. As Pauline has said, my name is Murugi Dirango. I'm the Director of Columbia Global Center in Nairobi. CGC Nairobi is one of 9 centers that have been established by Columbia University around the world to create opportunities for shared learning and to deepen the nature of global dialogue. Today, we are very delighted to host this online event in collaboration with the Department of Population and Family Health at Columbia University Millman School of Public Health on improving capacity to address gender-based violence in Kenya, a cross-sectoral conversation about achieving justice. This event will share initial findings from the program on global health justice and governance research focused on access to justice and gender-based violence in Kenya during the COVID-19 pandemic, and legal and public health approaches to interventions. The Columbia Global Center's President's Global Innovation Fund supported public health students to research the state of gender-based violence prevention and response work across Kenya. I would now like to introduce our moderator, Dr. Terry McGovern, who is a professor and chair of the Department of Population and Family Health at Columbia University Millman School of Public Health, to introduce our distinguished panelists. Welcome, Terry.
Thank you, Murugi. Good morning, good evening, everyone. Thank you so much again for hosting this. Thank you, colleagues at the Global Center, Pauline and David, panelists who I'll introduce, and our team, Nitu John, Neha Raval, Charlotte, who you will hear from. We're very excited because this work is related to our new program, Global Health, Justice, and Governance, which is a university-wide initiative housed in the Haburun Department of Population and Family Health, which is looking to take on public health challenges by advancing justice in the areas of gender, environment, and food. And the program is multidisciplinary, combining public health, legal, scientific scholarship, and practice. And we are very interested in what we're calling governance, which is how are the standards that are being promulgated often by the multinational system or donors or requirements, whether they're missing, formal, informal, how do they either promote or hinder justice in health outcomes? And of course, what's being funded and what isn't is very interesting. What are the donor requirements is very interesting in many different contexts. So, we're taking a look at that in addition to the outcomes. Thanks to the generous support from the President's Global Innovation Fund, as Murugi said, we have a body of research and partnership in this space of gender-based violence, access to justice, and public health in Kenya. I'm a lawyer myself, worked for many years with women with HIV. There were many GBV access to justice questions. When I was a program officer at the Ford Foundation, I heard lots about the access to justice mechanisms, sometimes leading to unexpected results, the prosecution of consensual sex between adolescents, and over a failure to address interpersonal violence. Plus, I saw that in countries that had plural legal systems, i.e., maybe religious customary law was as binding as civil law, some of the great new laws that were being passed were not actually having the impact they should, because many places in many countries were still following these other plural legal systems. And this wasn't something that a lot of the global governance actors seemed to be paying attention to. So we decided to partner with ICAP and take a look at some of the brilliant work that they were doing to try to go deeper into this whole area. So in the summer of 2019, we sent a public health student and a law student to Kisumu in partnership with ICAP to work at the GBV Recovery Center and to work with the GBV Recovery Center paralegal and other members of the Jaramogi Oginga Odinga Teaching and Referral Hospital, or JUTRA, and ICAP teams. In 2013, and we'll hear about this from Mary, Kenya had opened a comprehensive GBV recovery center there, the first such center in western parts of Kenya, which have the highest prevalence of GBV. The one-stop center provided comprehensive services to GBV survivors, HIV testing and counseling, medical evaluation and treatment, emergency contraceptives, STI screening, and Mary will say more, but the Columbia Law student and public health student assisted with data collection, helped improve monitoring and evaluation, did legal research, and really assessed with Ife's help, which she'll talk about, the state of criminal law in Kisumu and Kenya and its application to GBV cases. In this last summer with COVID, our public health students, Charlotte being one of them, broadened their research to study the state of GBV prevention and response work across Kenya in access to justice, but situated in the context of COVID. We had received some additional funding from the Ford Foundation to look at gender-based violence policies, law, funding in Kenya, Uganda, and Colombia. So we ended up combining all of this work and really trying to get a deep picture of what's going on. This work is also now happening in Nigeria and South Africa and the US, where we're doing a rapid assessment on the COVID-19 impacts. The availability of gender-based violence service provision and comprehensive SRH services. Again, we're looking at how COVID-19 shifted donor and government priorities, the legal landscape, and what has happened to essential GBV and SRHR services. The evidence will hopefully help everybody figure out mitigating steps to take and to do it better the next time. Of course, our country partners are leading in every aspect of this work. Some of what has emerged, the Kenyan judiciary has taken many efforts to support access to justice, but there are still a lot of improvements to be made. This will be discussed this morning. Obviously, as in all countries, key challenges in Kenya include implementation issues of GBV laws, policies, and operational guidelines. As in many other places, GBV has been normalized and survivors have been discouraged from accessing services and seeking justice, in part because of delays in access to justice. Health facilities serve as one of the first points where survivors start their access to justice journey, yet most facilities have limited capacity to handle GBV survivors in their journey to accessing justice. And again, as I said earlier, the plural legal system issue, at least in Kisumu, we saw sexual violence going to criminal courts and interpersonal violence often going to tribal courts or ignored. Lots of issues there, which Ife will unpack. Just quickly to end COVID-19 and GBV, gender-based violence is highly prevalent in Kenya, with 40.7% of women having experienced some form of GBV in their lifetime. This was already widespread before COVID. Since the onset of lockdown measures, according to UNICEF, there has been a 775% increase in calls to GBV hotline. The Kenyan government did not deem GBV services as essential at the start of the pandemic, while maternal care and sexual and reproductive health were considered essential. Many GBV services and centers are located in referral hospitals, which were designated as COVID isolation wards in March and April. The closing of shelters due to inability for social distancing and healthcare worker strain, in combination with the reassignment of GBV service centers, further imposed restrictions for girls and women seeking to escape abusive situations, all exacerbated due to self-isolation. From some of our interviews, following the first case and subsequent announcement of the government of Kenya containment measures in early March, many survivors who reported to the police were turned away and informed that the police were handling COVID only. Our interview respondents observed that COVID-19 containment measures resulted in an increase in GBV cases. They felt the reporting of cases during the COVID-19 pandemic was limited due to several factors: restricted movement, curfew, fear of perpetrators living in the same house as the survivor, and fear of contracting COVID-19 in public transportation and health facilities. Courts were closed throughout Kenya in the early phase of the pandemic, and when they reopened, they held fewer sessions, postponed pending cases, and gave lenient bail to perpetrators to avoid overcrowding the remand prisons. Just a few bits from our research. At this point, I'm going to introduce the real experts, our panelists. We are so honored to work with Dr. Mary Mwangi, who's a gender consultant with who many of you know, with a passion for supporting gender-based violence prevention and response programs and research in Kenya. She has supported integration of violence prevention and response in adolescent and adult HIV prevention and treatment programs, development of Kenya's multi-sectoral SGBV monitoring and evaluation framework and database, a comprehensive one-stop gender-based violence recovery center in Kisumu, the one we were discussing, adaptation of the WHO GBV quality assurance tool, and development of a sexual gender-based violence forensic management curriculum. She's worked with the government of Kenya and other stakeholders to implement the 2010 and 2019 Violence Against Children surveys and national action plans to address violence against children. We are incredibly lucky to have her working with us. Next, we have Dr. Charlotte Roy, who is a fellow in the Global Emergency Medicine and MPH candidate at Columbia University. She completed her residency in emergency medicine at University of Chicago and earned her medical degree from Weill Cornell Medical College. Before this fellowship, she participated in research and clinical work in Haiti, Guatemala, and Peru, and has worked with asylum seekers and refugees in the US. She's a research assistant for the Columbia Program on Global Health Justice and Governance and has been working all summer on this issue of the impact of COVID-19. She practices clinically in the emergency department at New York Presbyterian Columbia University Medical Center, and we're really grateful for her. And of course, last but not least, we have Ife Osaga Ondado, is the head of the Legal Sub-Saharan Africa Google. She has a background in law and international development with over 20 years experience in the public and private sector, with extensive work experience in the US and Africa. She was general counsel at Innovations for Poverty Action, has worked at the International Finance Corporation, World Bank Group, UNHCR, and Oxfam America. She has experience in various aspects of law, corporate technology, intellectual property, litigation, global business, regulation reform experience, and experience in international development in areas of democracy and civic education, gender and access to justice, legal reform, institutional and capacity building. We actually were lucky enough to have Ife work closely with our student the law student and supervised our law student last summer. So also really grateful to Ife. Okay, now we're going to start to open up the discussion. And I guess my first question is to Mary, and then I'll do a couple of questions to Mary and follow up quickly with Charlotte. So Mary, can you explain the current GBV prevention and response model in Kenya? And what are some of the successes that Kenya has seen in response to gender-based violence? And maybe you could answer in about 5 minutes.
Yeah, thank you so much, Terry, for having me, and thank you to all our listeners. Addressing gender-based violence is a complex process, and you know, Kenya has deliberately used a multi-sectoral approach to address GBV. We have good leadership from the State Department of Gender in the Ministry of Public Service and Gender that leads and coordinates, you know, both state and non-state actors. So our multi-sectoral approach has, you know, the health sector represented. We have education, we have child protection, we have police, we have justice, community, and social services. In addition to the work that the State Department of Gender is doing, we also have the National Gender and Equality Commission, whose work is to ensure that government and all the other actors, you know, pay attention to issues of gender equality, and that interest groups such as women, children, persons living with disability are included in development process and in all the work that we do. In terms of the health services, you know, you all know that, you know, gender-based violence is a public health issue. Most of the health services are provided to survivors in the public health sector. We do have a few one-stop gender-based violence recovery centers, mostly found in urban, you know, towns like Nairobi, Mombasa, Kisumu, but these are few, you know, and some of them are privately owned, but others, you know, are, you know, public facilities. I want now to move on to what is working. There are very many things that are working well, and you know, we could spend a lot of time talking about that. I will probably just try and highlight a few ones. I think the first one is that we have an enabling legal and policy environment. And my colleague Ife will be speaking to our legal context, you know, how it looks like, the challenges we have, and so on. I have mentioned the strong coordination by the State Department for Gender. I think we are now in a ministry where gender issues are getting a lot of attention compared to, you know, previous years when gender was lumped together with labor, and it didn't get as much attention. So that is something that our respondents felt is working very well. In addition to that, all the different sectors that I've mentioned seem to be working well together. Definitely there are areas that could be improved, but we have a multi-sectoral approach that's working very well. Remember, for you to tackle gender-based violence, you need actors in prevention. You need the police, you need judiciary, you need health, and you know, you need education, you need to work with child protection. I think the State Department has done a wonderful job. State Department for Gender has done a wonderful job of making all these players, you know, come together and address the issue collectively. In terms of strategic information, I think we all appreciate that we need to have routine data that can tell us what's happening in terms of the GBV situation in the country. Kenya has come up with a multi-sectoral sexual and gender-based violence monitoring and evaluation framework and an electronic database at the National Gender and Equality Commission. This work was done by all the sectors together. And the ideal was that every sector would send their data to the National Gender and Equality Commission database, which would provide us with a very clear picture of what the issues were, which populations are most affected, who is getting services and who is not getting services. And of course, this is the data that would help us in terms of advocacy and also resource mobilization. In addition to that, over the years, we have been very careful to integrate a GBV module in the Kenya Demographic and Health Survey, which is conducted every 5 years. And like Terry mentioned about part of my work, Kenya is one of the few countries in Africa that has actually conducted 2 waves of the violence against children survey. These are special surveys that specifically tell us what is happening to children, during their childhood years. And I think we recently had a launch of the 2019, by the Department of Children's Services. And I hope most of you, are aware of what the findings are. We've seen some declines in sexual violence, but again, COVID now is writing a different story. We've also enjoyed very good political goodwill, from time to time, but specifically our respondents felt that we have enjoyed very good political will when it comes to ending female genital mutilation. Kenya has an ambitious goal of making sure that there is no FGM in this country by 2022, which is exactly 8 years ahead of the global goal to end FGM by 2030. And part of this, ambitious goal is because we have a fully dedicated anti-FGM board whose work is just to pay attention to issues of FGM. In addition to that, we've seen some 4 counties really step up, and this include Kisumu, Meru, Migori, and Makueni. These counties have already domesticated sexual and gender-based violence policies. Kenya, for those who are not aware, has 47 counties. We still see this as a good success. When policies are in place, then it paves the way for people to allocate resources. And maybe I wouldn't end talking about these successes without mentioning one county that has really set the bar high and demonstrated how county leadership can prioritize gender-based violence and begin to come up with sustainable ways of addressing this. And this is Makueni County, and I think it's a story that needs to be told.
Okay.
Thank you, Terry.
Thank you so much, Mary. We're living in a time where there's not a lot to celebrate. So it was really nice to hear your kind of list of the really good things that have happened. But we do continue to see high rates of GBV in the country. So can you just talk a little bit about what isn't working? And by the way, let me remind the audience to please put questions in the chat if you have them. Thank you, Mary.
Thank you, Terry. There are definitely quite a few areas, that we need to improve on. And I want to specifically focus on some of the key obstacles that our stakeholders, identified. The first one is inadequate prioritization and funding of GBV programs. All our respondents felt that the national and county governments have not put enough emphasis on the issue of sexual and gender-based violence. Remember, we have 47 counties, and out of the 47 counties, only 4 have domesticated those policies. And we're talking about 10 years after devolution. So there's a slow pace in terms of domesticating GBV policies at the county level. And until we do that, we will probably not see sufficient resources, becoming available to the programs on the ground. Our respondents also felt that our reliance on donor funding is not really a sustainable way of doing it. So I think going forward, one of the things we want to do is make sure that the government at national level and at county level is prioritizing gender-based violence. And I think I want to quote respondents who felt that, given what COVID has done, that GBV really must be declared, a national disaster. We know when things are declared national disasters, then, there are structures and policies and funding, that flow to address the issues. There were quite a number of challenges on the GBV prevention side. I want to start maybe addressing our prevention efforts. How do they look like? What are the main obstacles? The first one is dealing with entrenched social and cultural norms. I think we all know that our diversity is great, but sometimes the norms that we subscribe to, that certain communities subscribe to, unfortunately perpetuate violence. They perpetuate female genital mutilation, early marriages, and other forms of violence. And I think we all appreciate that shifting these norms is not a one-year thing, it's not an easy thing, but we all know that we have evidence-based interventions that can help us to address and shift those norms. Our desire to fight FGM by 2022 must squarely address communities that feel that FGM is part of their culture and it is okay, and they don't want anybody, to touch it. The second issue is stigma and what I would call a pervasive culture of silence among survivors, but most important, among duty bearers that we expect to prevent, and to talk about and take action around violence when it occurs. Stigma and the silence that we see among survivors and duty bearers lead to low reporting. And of course, when people do not report, access to service becomes difficult. In terms of responding to violence when it has occurred, we probably encounter a lot of challenges along the referral pathways. Survivors have to move from one system to the other. And I think one of the critical things that we all appreciate that needs to happen is a seamless movement from one service point to another, because we do not have enough comprehensive one-stop care centers throughout the country. I will start by talking about healthcare system challenges. And I think Terry has mentioned some of them, so I'll go over this very quickly and just present what our respondents identified as challenges. We have limited capacity in the healthcare system in terms of providing post-violence services. And our respondents were very clear that in a lot of facilities, the healthcare workers are not well trained to handle GBV, even though Kenya has very good national guidelines on how to manage SGBV. Without adequate training, then it means that these healthcare workers are unable to provide a comprehensive service. Things like counseling are sometimes just not available, for survivors. You will get the clinical services and there's nobody to really provide you the psychosocial support that you need to deal with your experience of violence. We have facilities that lack registers, that do not have post-rape care forms. And what that means is that we are not documenting the cases, so that what we have in our DHIS, the data that we have in our systems, in our data collection systems, does not capture the full extent of the problem. In addition to that, we have a lot of healthcare workers who are not very conversant in terms of, filling the post-rape care form. And yet we know this is a legal document. If it is not very well completed, then it means that we do not have a strong case that can help us to help the survivors to access justice. Our providers are also sometimes not very willing to appear in court to provide evidence. And in some cases, they will ask for a facilitation fee, to complete the form, the post-rape care form, and to appear in court. That is something that, negates access to justice. In terms of forensic evidence collection, we see very major gaps, even though Kenya has most recently completed a curriculum that will help healthcare workers to manage forensic evidence around violence in a better way. We do not have post-rape care kits in our facilities, and I think it's okay when we innovate, but we don't find that a lot of facilities are innovating and assembling these kits together. I want now to move on to shelter. We all know that shelter is very important because a lot of the perpetrators are always, are known to the survivors, or they live in the same household with the survivor. And Kenya has one state-funded shelter, and it happens to be in Makueni County, our favorite county. What happens is that survivors go back home in a lot of places, and particularly children who have been violated in a household. When they go back home, we increase opportunities for repeat violations. We increase opportunities for threats and witness tampering. And over time, we have found that whether it's women, whether it's children, there is reluctance to pursue the justice, process, simply because these people are living together. So being able to provide shelter is something that we probably haven't done very well. But there was also a concern that women and girls also encounter violence and abuse in some of the privately owned shelters. And this is probably a problem that we haven't looked at very keenly. And there's need for us to really look at, safety around survivors who go to shelters. In terms of monitoring and evaluation, I think I did mention about the multi-sectoral database that we have at the National Gender and Equality Commission. Unfortunately, all the sectors are not reporting. And of course, when all the sectors do not report, then it becomes very difficult for us to assess how our referral pathways are, to know whether we are doing well in terms of addressing GBV, to know which are the most affected groups, which areas require a lot of resources or focus on. We lack that comprehensive data. And, we have most recently seen the downside of not having a good routine system, for reporting. And needless to say, each one of the sectors that I've mentioned, has their own, sector-specific tools, and ways of collecting data. But when it doesn't come together, then we don't get a very complete picture.
Okay.
Now, we also have some donor-related challenges. And, our respondents did come up with very many challenges. I'll probably just highlight a few. One is a lack of alignment between the donor priorities and the realities on the ground. We had respondents who felt that, donors will tell you, can you just do community dialogue alone with our money? And yet community dialogues, they're important, but that is not the immediate concern.
Of course.
If you are working in a county like Samburu, your concern is to keep these girls, in a boarding school so that they don't get, they don't undergo FGM, and they don't, they're not married off early. So that is probably a challenge, and our respondents attributed this to the fact that donors do not often speak to the grassroots organization. They'll probably just speak to government and speak to a few well-known NGOs, and they come up with the priorities and the targets that need to be achieved. A second related issue is focusing on numbers, or targets. In Kenya, we call them, particularly when it comes to survivor services. The process of healing for a survivor is not a 1 month process. Survivors need a lot of support, sustained support. So when donors insist, we want you to reach 1,000 survivors, that becomes a tall order. So I think we need to pay attention to targets, but at the same time, we must be interested in outcomes and impact, things that take a lot longer, to achieve, and especially when it comes to survivor services. There was also the issue of donors providing very short-term grants. Some of our respondents had grants that were 6 months, 8 months, 9 months, 1 year, 2 years. That becomes a challenge, especially when you need to address things like norms around violence. But it also means that you go and do into a community, do your work very quickly and get out, okay? So how do we get consistent funding and consistent support? And they felt that perhaps 3 to 5 years, does make sense. You will be able to go to the community, engage them, and be able to achieve some, some lasting impact in that community. There is also a preference to work in certain counties. We find that donors sometimes coalesce around very specific counties. And, counties such as Kilifi were mentioned. We've had challenges in Kilifi. But when everybody goes to Kilifi, it means a county like Migori, which also has a high need, or some rural areas, there's a preference for urban areas. Girls and women and children in those marginalized areas and rural areas and counties then do not get service. Finally, I think the issue of complex funding requirements, which tend to lock out grassroots organizations. We are all aware of donors who say you must have, received over $2 million US, in the past. Your chief of party should have a master's degree. When we look at our grassroots organizations, and these are the people who are actually working right now during the COVID pandemic, they have people who are experienced, in survivor support, in doing advocacy. They may not have the qualifications, or they may not meet the requirements that donors are put in. And they felt that by locking them out, we tend to work day in, day out with well-known non-governmental organizations. Finally, we have a lot of issues around access to justice, and my colleague Charlotte will talk about this. Thank you, Terry.
Mary, thank you for that really amazing and complicated kind of set of comments. And I think that this whole process and the research is going to get at all of these complexities and hopefully help. But thank you so much. Charlotte, do you want to add anything here before we turn to the justice legal context, since you've been part of this research as well?
Yeah, thanks. So I did some, as part of assisting with the study this summer, I did some in-depth interviews with legal organizations that assist survivors of GBV in Kenya, and they identified a number of barriers in terms of women being able to access justice. One is just limited resources, limited access to legal services. And one respondent we talked to said, we are overstretched. There's a lot of pressure to serve a large number of clients with very few lawyers. Sometimes they get volunteer lawyers, but they're usually temporary and there's high turnover, and that requires a lot of resources that go into training them. There are also a lot of delays in dispensation of justice. This is a major issue for survivors because the delays are so long that women sometimes just give up. One respondent said that when it comes to cases of violence against women and girls, rape cases, defilement, they can take years, 3, 4, 5, even more years to really see their day in court. And these delays dissuade survivors from reporting because they know it's going to take a long time for their case to go to court. It also, the delay provides a time period in which there can be witness tampering, and perpetrators often are released and they can threaten the survivors, so that's very problematic. There's also a general issue with laxity of duty bearers. The institutions that are mandated to respond to violence against women and girls, namely courts and police, have not really prioritized the issue. For example, some of the things that respondents mentioned are police don't arrest perpetrators in time. Sometimes they require or they ask for money or transportation to arrest perpetrators. Some cases are not reported because the police are bribed or because they know the perpetrator, they're a friend or a family member, and so they decide not to report it. That's also been an issue among local leaders and chiefs. They won't act on cases that involve relatives or friends. There are cases where local leaders mediate on defilement and rape cases after receiving complaints rather than referring them to the judiciary like they're supposed to. In terms of health providers appearing in court, often bond, which is the notification to appear before court, is delivered so late that they don't have time to prepare, or they don't have time, they're not able to actually appear in court. In terms of FGM, politicians and elders protect perpetrators of FGM, and prosecution of FGM is rare because there is that collusion between perpetrators and local leaders. So those are some of the things that we discussed with local organizations regarding access to justice and barriers in that area.
Thank you, Charlotte. We're going to come back to you in a bit, but let's turn to Ife to talk about the access to justice legal context in Kenya in relation to GBV, plural legal systems, sexual violence versus interpersonal violence, community healthcare workers. Ife, can you talk to us about all of this?
Thank you, Terry. And thank you very much, Mary and Charlotte, because actually you have touched on some of the things that I was going to talk about. So I'm going to not say too much about those issues. I just want to give a brief overview of the legal framework that we have in Kenya dealing with GBV. And as Mary said, it's very robust. We have a very robust legal system, starting from the international norms coming down to even the county level, you know, where, as Mary mentioned in her presentation, we have, I think, 4 counties that have put together a policy legal framework to deal with the gender-based violence. So really the legal framework is in place. But of course, as I will explain in the next few minutes, I'm going to try and keep it very short because we don't have too much time. There is, definitely a gap between, what is in the law and what actually happens on the ground. Now, generally, I just want to have start with a brief definition of gender violence. I'm not going to go into too much detail because there are several definitions, but it's always important to be clear what a definition is, because then it determines the legal consequences. So luckily, we're not in a court of law, so we can just rely on a very, very simple definition. The WHO definition, which is that it is any harmful act that is perpetrated against a person's will, and that is based on socially ascribed differences between males and females. So brief definition, very important to start with, what we're talking about. Now, when we talk about violence, it could be in various forms. It could be sexual violence, where we talk about rape, defilement, incest, sexual abuse, sexual exploitation, forced prostitution, physical violence, which would include assault, human trafficking, slavery, emotional and psychological violence, including verbal abuse, or harmful traditional practices that have been mentioned, such as FGM, and as well as socioeconomic violence. So, from the Kenya perspective, we find that Kenya subscribes to several international instruments that address violence, okay? And Kenya is a signatory to the Universal Declaration of Human Rights. And I don't want to say all of them because there are very, very many, but, really Kenya is a signatory to several international instruments that, deal with issues of gender violence. And this is at the international level. And then also at the regional level, you find that, we subscribe to the protocol to the African Charter on Human and People's Rights, on the rights of women, as well as the rights of children. And now I'd like to spend a little bit of time talking about, what is the national legal framework at the national level in Kenya. And this starts with the Constitution, okay, where the Constitution provides for the protection of human rights for both male and women, and the prevention of degrading, torture, and inhuman treatment. So it doesn't really address gender violence specifically, but provides the basis for the other laws that that also deal with the issues of gender violence. And these other laws include the Penal Code, the criminal law, criminal procedure, and several amendments to criminal law, like the Criminal Law Amendment Act of 2003. And then we have the Sexual Offences Act, which has had several amendments, and actually is the most comprehensive law on gender-based violence in Kenya. In the recent years, we've seen this law expanding the definition of sexual offences, introduction of new sexual offences, creating minimum and mandatory sentences, as well as penalties, enhancing and providing stiffer penalties for sexual offences, as well as dealing with the issue of the burden of proof. Because a lot of the gender-based violence offences fall under the Penal Code and criminal law, it means that, really the standard is, to prove the burden of proof is beyond a reasonable doubt, which is a very, very high burden to discharge. And this, amendments deal with, limiting this very, very, or trying to ameliorate this very, very heavy burden. And then, it has also, the Sexual Offences Act has also established a register of sexual offenders, as well as setting up a DNA bank, a data bank, and a pedophile registry. Now, in addition to that, you have a number of other laws, like the Counter Trafficking in Persons Act, the Prohibition of Female Genital Mutilation Act, the Children's Act, and the HIV Prevention and Control Act. And then you also have some procedural laws like the Evidence Act, which, as I said a few minutes ago, governs, how evidence is brought to the court and how evidence is collected, and to be able to enable the prosecution of offenders and hopefully bring justice. Now, there's also the Criminal Procedure Act that governs the arrest and prosecution of suspects. Though, on the ground, the reality is that it's not pursued as vigorously as it should. I think Charlotte has mentioned a little bit of the challenges that people face when going to the police to seek assistance. Sometimes, they are in situations where they're asked to facilitate. You find there's a reluctance to prosecute these offenses. So there are some challenges with the Criminal Procedure Act and its implementation as regards gender-based violence. Same thing I would say for the Civil Procedure Act. That also is a law that would come into play in situations where victims would be seeking some sort of compensation, and in this instance they would have to rely on the Civil Procedure Act to be able to seek this to seek compensation. Again, this is also challenging for a lot of GBV victims, as we all know that the truth of the matter is that they're already very vulnerable in the first place, and therefore to be able to understand how to interact with the legal system and ensure that they're able to adhere to the laws, the rules and regulations, the policies and procedures. This is definitely a huge challenge for them. So just generally, to be honest, there's a lot we could say about the different laws and regulations, but I think I just want to at least share the broad overview, and for everyone to be aware that this is something that's actually dealt with in a multi-legal framework with lots of laws touching different aspects of GBV. So the framework does exist. I think the challenge, as I said earlier on, is the issue of enforcement. And some of these issues also were very clear when the law student from Colombia did research this past summer, and it was very, very clear that that actually enforcement is a huge issue, even though we do have the laws in place. Like Charlotte says, there's the issue of resources, and the issue of having paralegals or legal personnel who are able to support the victims of GBV and guide them as they go to court. There is a real, like Charlotte says, they're overstretched. But there's also the issue of resources and being able to, there's also the issue of being able to understand legal procedures. Legal procedures are very intimidating, and especially for rural women or victims who may be purely educated and who may not be accustomed to speaking for themselves or representing themselves publicly. It is very, very intimidating for them, and therefore, it discourages them from going ahead and reporting such instances. We talked about the delays in dispensation of justice. Courts take a long time to resolve cases, and in the time of and in this period, when as time passes, a lot of things go wrong. There's witness tampering, loss of information, loss of evidence, and that definitely makes it very difficult to to convict the perpetrators. Also, the court procedure sometimes prevents survivors from seeking legal redress because of the lack of privacy. Because you find that sometimes when people go to open court, and they have to explain, the situation or what they have gone through in open court, or even the lack of sensitivity by court personnel in the way in which they discuss the cases or they bring up the cases before the magistrate. That makes it very, very difficult for for victims. I actually about a week ago, I was working with a few victims who had cases going ahead, and I was very disheartened to find out that that there really wasn't much sensitivity in how their matters were dealt with, and they were very, very reluctant to go back to court. And there have been several instances where the victims simply just don't show up anymore, just because of the whole trauma of going through the legal process. Now, the law has mandated that there be gender desks in police stations, but we know that it works in some places, it works in many places, it doesn't. There's no standardized procedures. The desks should be in a confidential place. They're usually in an open space, and people have to then explain their situation, what they have gone through in a very public manner, and this of course discourages people from going ahead with reporting. Sometimes police men and law enforcement officers are not sensitized on how to deal with people who are victims of gender-based violence, and this of course affects the ability to report. And the other thing that came up very clearly in the research that our student did was that with the complications and difficulties of seeking justice in the formal system, a lot of gender-based violence survivors resort to traditional justice systems. And these justice systems, really are geared towards reaching a consensus rather than securing justice for the individual survivors. And it's also not clear if they really have a deterrent effect. And the truth of the matter is that also at the community level, there's a really serious lack of awareness that these issues of gender-based violence are unlawful and should not be settled out of court. And communities are also unaware that, when it happens, that you should seek health interventions immediately. You should also probably go to the police station to get the necessary documents, such as the P3, to be able to report, and how to preserve evidence. This knowledge doesn't exist in the community, and it's a huge issue, because a lot of victims will then resort to the traditional systems because they're not aware that they really should pursue the formal legal system, and for them they are already intimidated by the formal legal system, and therefore in this instances justice is really not met, and that's definitely a big issue. Now, I think Mary talked a little bit about how health facilities also lack adequate resources, knowledge and skills on collection and processing of forensic evidence, as well as equipment used in the collection of forensic evidence. Like she talked about how very few health centers have rape kits, and this of course affects the ability of people to get justice, because then they are not able to provide evidence to be able to support the issue they have in court. So these are just a few challenges. I think I will leave this to to others to continue. I think at the end we have an opportunity to give recommendations, and I'm happy to talk some more at that point.
Thank you so much, Ife. I think, of course, as I knew we would, time is passing more quickly, so I'm going to combine a couple of questions now for Mary and Charlotte, which it's been touched on already. All of you, of course, can answer. How has COVID-19 exacerbated inequities? How has the government responded to issues of women and girls during the pandemic? And then we'll come back to how the donors have responded. So Mary, do you want to start there?
Yeah, thank you, Terry. I think just to quote one of our respondents, COVID-19 has laid bare the weaknesses in our GBV prevention and response system. I think in terms of preparedness, we saw a lack of preparedness because the COVID-19 response plan was initially gender blind. It paid attention to gender and GBV when we started seeing a surge in cases. Some of the immediate impact of the COVID containment measures, that started, around mid-March include a cessation or a stop of community and school-based violence prevention work. There was, a lot of the organizations we spoke to just closed shop. So there was nobody out there in the community and the kids were back at home. So the important violence prevention work literally came to a stop. The closure of schools is equated to the closure of a safe space, particularly for girls. We have seen a rise in defilement, teen pregnancy, early marriages. In communities like Samburu and West Pokot, we have reports about hundreds of girls, being, undergoing female genital mutilation. I think one of the respondents gave a very sad situation where girls in Samburu, and I think in West Pokot, in Samburu, ran to the forest, so that they escape FGM. But the communities, in her words, still went to the forest, got them, and circumcised them. And of course, in these communities, FGM opens the way for early marriage. After FGM, the next thing is early marriage. And these are schoolgirls. We are also aware of the economic impact of COVID. Women and girls have gone, without food and without basic necessities like dignity kits and so on. And some of our respondents talked about escalating cases of transactional sex, and sometimes parents telling girls to go out there and come back with money for food, and that has promoted transactional sex among girls, in some of the communities, marginalized communities. There was initially decreased reporting and utilization of health services due again to the containment measures, the lockdown, the movement restriction, the curfew, but most important, as mentioned earlier, fear of COVID infection in hospitals and in public transportation. Cost of public transportation went up because the vehicles could only carry a limited number of people. What all this meant is that survivors who accessed services came late. Opportunities to prevent HIV, opportunities to prevent, unintended pregnancy, we missed all that. And, perhaps some of the girls that we have seen, are pregnant, could have been helped, if they had accessed health services in good time. There was a surge in reporting of violence around the month of May and June. And I think in one of the national hotlines, 1195, they talked of almost a tenfold increase, in cases around June compared to February this year. I think the closure of shelters has been mentioned. Shelters were no longer taking in people because, of course, there was the fear of COVID-19. And some of them also could not economically sustain themselves, because of all the economic impact that COVID has visited on not just organizations, but on everybody. My colleague Charlotte will address the impact of COVID on access to justice.
Yeah, so, excuse me. There have been a lot of impacts of COVID on various areas, including on police and the judiciary. In terms of police, some of the issues that were raised by respondents in our study were that, similar to health providers, police were deployed to enforce COVID-19 containment measures, and this drew them away from the police station and made them less available to take reports from survivors of GBV. Some survivors reported that they were initially turned away, and they were told that police were only handling COVID-19 related issues. Some survivors were also told by police that they needed to wait 2 to 3 days to report. Another issue was a lack of masks. So it was required to have a mask to enter a police station. And at the beginning of the pandemic, masks were not available to most people. The National Police Service, part of their response has been that in June, they set up a toll-free hotline for GBV to address low reporting to police. And the way it works is that reports that are received through the hotline are then channeled to the nearest police station to be followed up. Some respondents identified that overall there's been a decreased demand for legal services, and this is thought to be due to decreased reporting overall. Typically where these cases start is when they report to a health facility and police station. And as mentioned, there's been decreased reporting to those areas. However, the proportion of clients of all clients calling for legal counsel who are survivors of GBV is increased related to, compared to before. For example, one organization said that, now about 70% of their calls are GBV, whereas before only about 30% of the calls to their organization were related to GBV. Legal organizations, many have had to close their offices. Some were able to stay open, though with temporarily reduced capacity. Some of the offices that have had to close have innovated by creating toll-free lines that allow survivors to continue to access legal counsel. So that's been a helpful response. In terms of court closures, the judiciary closed the Nairobi High Courts for 2 weeks starting in mid-March, and then they were reopened, but only to legal advocates. At one point, they set up an outdoor tent for the high courts for judges to operate outside. Since then, though, cases of COVID in the Nairobi High Courts as recently as July have led to closures for 2 weeks at a time. And these COVID-19 outbreaks in courts have also caused closures in lower courts, including in Makadara, Mombasa, and Milimani. And of course, these court closures ultimately have increased delays and worsened the backlog of GBV cases. Most cases going to the high court are getting court dates in 2021, and there are not quite so many delays in the lower courts. Another issue that I believe Terry identified earlier is that in an effort to decongest prisons, perpetrators are being given more lenient bond terms, and there's concern that this could cause evidence tampering and repeat offenses. In terms of the government response, they've made a point of saying that courts need to continue addressing cases of GBV, and the government has encouraged people to refer cases from the community, and they've done radio spots to promote that. And there is still a 9 p.m. curfew in place, but survivors are allowed to come in to report after the curfew. Police have also been sensitized that they need to still respond to GBV cases during COVID. In terms of new measures, the judiciary introduced e-filing in July, and the courts are also offering virtual services, though that's, it's difficult to access for women, particularly who are poor or who live in rural areas who don't necessarily have a computer or internet access. Yeah, I think that's about it in terms of the impact of COVID on legal services.
Thank you, Charlotte and Mary. So can we just turn to funding? I think, Mary, you outlined a bunch of problems, including lack of funding to the smaller NGOs that are actually doing kind of creative work on the ground, short-term funding, switching off in funding trends, the need to really dig in if you're going to really shift social norms. But can you talk about kind of how donors have responded to COVID? A couple of things, how have they responded? Have resources been made available? Or have you seen shifting from GBV resources from GBV to other sectors? So that's a question for Mary and Charlotte. Mary, please.
Yeah, thank you, Terry. Maybe before we get into donors, I'll probably just quickly go through the government response in other areas, in addition to what Charlotte has shared about, the justice actions, So I think, the government of Kenya initially didn't see GBV as, something, an essential service, but I think down the line, there has been that recognition. Specifically, there has been excellent coordination by the State Department for Gender to coordinate all the stakeholders and to have a weekly meeting initially, and bi-weekly meetings to discuss issues arising out of the pandemic. One of the successes is, their ability to advocate for integration of gender and GBV in the COVID-19 national response. So they have been active in terms of making sure that, if it's the economic safety net that's being discussed, that it is a gendered, process, and that women and girls issues, are shared and, addressed. They have also engaged in terms of mapping of shelters in the country and sharing the information with other stakeholders. Remember, we said shelter became an issue. The National 1195 hotline has also continued to work for 24 hours. I think with the help of the donors, additional counselors have come in to be able to offer advocacy, reporting, psychosocial support, and referral services for survivors. In addition to that, there has been high-level attention to issues around GBV coming from the highest office in the land, and that is the president. And he has issued several directives. I'll run through some of them very quickly. On July 6th, he directed the National Crime and Research Center to investigate teen pregnancy and defilement and report back in 30 days. On July 9th, he announced free pre- and postnatal services for teen mothers and directed chiefs to enumerate pregnant girls and help identify the perpetrators. Most recently, on September 10th, there was a cabinet memo that was released, and it approved an interagency program on GBV during COVID-19 that will pave the way for the establishment of toll-free hotlines, online and mobile applications that will facilitate anonymous reporting of GBV. I think there has also been intensified public awareness and sensitization, and in the communities where FGM, for example, is happening, leaders, county leaders and local leaders have walked door to door, from one door to another to just make sure that the girls are okay and that FGM is not happening. There's also an economic safety net that I think I mentioned of about Kenya shillings 1,000 a week that has been provided to the most vulnerable populations, including people living in informal settlements. I think the Ministry of Education also proposed a community schooling program, to try and address particularly children who do not have access to e-learning, and just to make sure that children are engaged, but they continue to receive the mentorship that we also lacked during the lockdown. But also principals and head teachers were directed to collect data on pregnant girls and report back by July 23rd. The National Police Service launched a toll-free hotline, and this is important, 0800 730 999, so that survivors can report. Remember, we talked about police not initially, being responsive to survivors who are reporting violence. Once survivors call to this hotline, a call is made to the police commandant in their nearest police station to take action. I think we've also seen establishment of a polycare. Polycare is a one-stop police station model that integrates all the services that you find in a comprehensive GBVRC, but it also includes services such as a magistrate. And the idea of the polycare model is to ensure that any report that is made is handled. The survivor receives all the services within 48 hours. And it's an exemplary model. We are looking forward to see how it will work. And I think Makueni County has also come up with their polycare model. Remember, I keep saying this is the county that is really setting the bar high in terms of what county leadership can do. I think our respondents were, as much as they felt that government response has given attention to the issue of GBV during the pandemic, they still insisted that that attention must come together with funding, that we should perhaps be allocating more resources to preventing GBV rather than reacting when it has occurred. And some also felt that some of the directives had instilled fear, like among local leaders, holding them responsible for the pregnancy. And also the lack of credible data in terms of teen pregnancy and defilement is something that respondents felt government needs to address. I will ask Charlotte to talk about donor response.
Thank you. I just we're at about 10:09 and we have so many questions. So just to Charlotte, if you could be quick, even though that's a huge question.
Yeah. So, I think it's been interesting speaking to the organizations. Definitely, it sounds like in general, resources were shifted away from women's organizations when COVID-19 first began. And there was a lot of advocacy by women's groups on TV, on radio, on social media to help shift resources back to women's work. I would say most of the organizations that I spoke to said their funding overall hasn't been too impacted at this point, although there are concerns that, with the next grant cycle in the future, that some of the donor countries will be feeling kind of the economic impact more at that time, and that it might be more difficult to get funding. I know a few organizations reported that bilateral donors pulled out of funding plans already due to the economic impact. And then I would just add that, some respondents said certain donors were more flexible in terms of allowing them to use funding to support new modalities of carrying out prevention and response, since a lot of the pre-existing activities could not continue. And also giving them flexibility to purchase PPE like masks and hand sanitizer for staff, I think was very useful. Yeah, so I'll stop there.
Thank you. So I think one comment is pointing out that, of course, all of these issues interact with other funding issues like the global gag rule, which actually meant that any group that is even counseling, referring on abortion can't receive U.S. government money. So there's been a lot of kind of disconnecting and tearing apart of kind of integrated referral systems, and that we've seen in our research related to the global gag rule. But just to say that that's a piece of all of this here. But let me turn to, we have so many questions, so I'm gonna put 3 up and let you respond, and then we can turn to a next set. One is, any insights from your work or research on specific successes or challenges to addressing gender-based violence, interpersonal violence in particularly marginalized groups like LGBTI, sex workers, migrants, women who use drugs, refugees, people in confinement. Then we have a question about, have the special courts for addressing GBV to reduce time spent in attending court, are they working? And then the last one I'll put out before we let you begin to try to answer these is, how do we hold accountable the county leaders in the remaining 42 counties that don't prioritize GBV? How do we demand that they prioritize GBV? So again, the 3 questions are the special courts to reduce time working? How do we hold the other county leaders accountable around prioritizing GBV, and any insights on challenges or successes around particularly marginalized groups? And I'll open it up to the group. Just let me know if you'd like to answer. Any takers? Mary, I see you're unmuted.
Yeah, thank you, Terry. Those are very good questions. I think we did talk to organizations that support what we call key populations. And the main key populations in Kenya are sex workers, men who have sex with men, LGBTQ, those are really like the main groups, and persons who use drugs, inject drugs. What came out is, and it is something that we know, is that we are a homophobic country. And respondents gave examples of LGBTQ survivors, when they experience violence and they go to a health facility. What becomes important is their sexual orientation. Our healthcare workers are not yet well sensitized in terms of providing services to groups, that I want to call key populations. What we have done in Kenya is to come up with, drop-in centers, that are very focused on key populations. And one of the things that I have supported in the past is to try and build the capacity of programs that are targeting key populations to be able to provide post-violence services. There's also the challenge that, a lot of providers think that, you're justified. I mean, there's a reason why you experienced the violence. Your sexual orientation is really the problem. So I think we have a lot of norm shifting work that we need to do with duty bearers and health providers in our settings. I also want to comment about the county leadership. I don't really have an answer on how to address county leadership, but I do know that in Kenya, we have a practice of benchmarking. I think the more we talk about Makueni, the more other counties will probably want to start doing the same. But we expect the grassroots organizations, the women organizations in the counties that haven't moved to actually advocate and push so that those counties begin to pay attention to issues of GBV. 10 years, 4 out of 47 in 10 years is too little, in my opinion. We have women representatives, in those counties. These are the people we need to challenge. When you're a woman representative in a county, issues of GBV, lie squarely in your docket. That is what you should really be pushing. So I think there are many ways that we can do, but I think strong advocacy. But we keep talking, and we keep talking about what Makueni is doing and sharing their lessons. Okay. I think I'll leave the special court question to Ife.
Okay. Thank you, Mary. Ife.
Yeah, I have to say, I haven't had or read a little bit much about whether these special courts have been very successful and how successful they have been. What I know is that there have been recently lots of calls for setting up this court, but I think at this point it's still very early on in the process for us to know if it truly works. I'm not even quite sure if that truly has been a sustained implementation, and I may be wrong. So I just want to say that that I think at this point it's still something that is early and still in progress, and we still don't have much information about how it works.
Thank you, Ife. We have another question that's for you, which is what, I think you kind of said this, but what specific challenges exist within the legal regime that make it impossible for victims of GBV to seek and obtain justice? That's like a bar exam question, sorry.
I want to say that I think I touched a bit of this in my earlier presentation, where I talked about the difficulty in understanding, the processes. Already the people who come to seek this, who come to court are already vulnerable and disadvantaged in one shape or form, and very difficult for them to understand the processes. Resources are not available for legal support. We talked about the delays in cases. We talked about the fact that there needs to be sensitization of law enforcement and judiciary staff in dealing with these issues. We also talked about the fact that the truth of the matter is that because of these challenges, people all often resort to alternative justice systems, which may not have the desired outcome. So I did touch a bit on that, so I don't want to spend too much time talking about it, but
okay.
Hopefully this answers the question.
Okay, thank you. So one question is, how can men, particularly opinion leaders, help in this community mindset change?
I think I can maybe attempt to answer that. I don't really have a perfect answer, but I think one of our weaknesses in the GBV agenda has been to leave out men. And I think we perhaps need to, our respondents felt that, if we don't get men on board, the job will be half done. We have interventions that address masculinity perceptions among men. We have interventions that we can work with men as change agents. And I do know a lot of programs that are working with Boda Boda. Boda Boda are motorbike riders. At the beginning of this mode of transportation, they were seen as perpetrators of violence against women and girls. But increasingly, I'm seeing a lot of programs working with them to champion and to talk to their colleagues to make sure that we provide the transportation. We don't abuse the girls, we don't abuse the women. They are our customers. So I think there's a lot to be done. In terms of leadership, if you look at leadership positions in Kenya, we have more men in leadership positions. And I think working to make sure that we engage those men to be able to put women's issues, GBV issues, in the top of their priority list is something that we need to continuously pursue. Right now, the president has been asked to dissolve parliament because of the 2/3 gender rule. Those are efforts that are going to help, move this. I think finally, I would want to say when it comes to men who are leaders and women who are leaders, I think there has to be a system of holding people accountable. If a chief will mediate over a sexual offense, and it's finished at the community, at the village level, and there are no consequences, then that becomes the norm. I think ensuring that all the duty bearers are held accountable, is going to be extremely important. I think for me, living in Kenya, our memory is so short. GBV will become an issue, and the next month we move on to something else. I think sustaining that advocacy is something that we need to extremely work on, and I think this is where civil society really helps a lot in advocacy.
Thank you. Anyone else? I think we have a number of questions about why is there such a difference between national policies and county level policies. And maybe this goes back to the accountability word that you've been using, but any response to that?
I wouldn't say that there's a huge difference and that, that is a problematic thing. I think counties are supposed to go, to align themselves to the national policies, okay? When we talked of devolution, we are trying to devolve funding, we are trying to devolve national policies and national laws to the county level. So I don't think that there's a county that has, policies that are so, if a county would come up with policies that are very different or radical, compared to the mainstream, the national policies, then that would be problematic, But I think Makueni County has demonstrated that they're embracing all these national laws and national policies. They're trying to make what our vision, our ideal vision of what, women and girls should be going through they're trying to actualize that, to operationalize that at their level. I think they have a lot more in common. And in any case, survivors, just to quote something I had, survivors don't care whether you're national government or your county government. What survivors want is services, period.
Thank you, Mary. Okay, so we're at the point at which I would just want to give each of the speakers a minute. Mary, you can go last because you've been working quite hard here. Just to make any recommendations or thoughts before we close. So maybe we'll start with Ife.
Yeah, I think going forward, I think what we should continue to do is to have the multisectoral approach that we have had, to just strengthen this approach to ensure that we work with, with the health sector, the law enforcement, the judiciary, members of the public, to ensure that we're able to deal with the issues of gender-based violence, because everybody has a part to play, and if we don't involve everybody, then we will not succeed. I think there's also the need for capacity building. I've talked about of law enforcement officers, also of judicial officers, both at the judge level, magistrate level, as well as the supporting staff. I think there's need to expand justice for vulnerable groups to the special courts, as has been raised a few minutes ago, and then also reform and expand legal aid services to provide effective and efficient services to vulnerable groups. I think one of the things that came out clearly from the study that was carried out last summer was that there really is a huge gap when it comes to providing legal aid services to victims of GBV. So and then generally I think that there's also just I need to continue to enact amend and implement laws and policies in line with the Constitution, in line with international and regional human rights commitments. I think that there's still a few gaps that need to be addressed there, and there should be a concerted effort to continue to work to review and amend as needed to ensure that we are able to protect the most vulnerable people in society.
Thank you, Ife, so much. Charlotte.
Yeah, so I mean, drawing on the interviews that we did this summer in terms of recommendations related to COVID, I think one thing that's been reiterated a few times by respondents is the need for preparedness. It sounds like in Kenya, the lockdown was announced pretty abruptly, and many organizations didn't have a plan in place. So preparedness both on the level of the government and also on the individual organization level, being ready for an event like this in the future and creating a plan that draws on evidence about how to respond to gender issues during disasters and emergencies. I think very important to ensure that gender is integrated into COVID response. As Mary identified earlier, this was a problem early in the government response. So it's important just to have structures in place to make sure that there is a voice for gender issues and that it's factored into decision making. And also just general strengthening of GBV systems. Like Mary said, it's not so much that the pandemic has created new problems, it's more that it's revealed the existing problems. So a lot of respondents felt like the impact of COVID could have been on GBV could have been reduced if we had stronger systems and structures in place previously. And then, of course, prioritizing vulnerable groups, women and girls in informal settlements, LGBT women, women living with disabilities, adolescents, and making sure that their needs are addressed during this time.
Thank you, Charlotte. And of course, last but certainly not least, Mary.
I just want to highlight some very few recommendations that came from our respondents, and then I'll just end with one personal recommendation. I think our respondents were very clear that government has to increase funding. Counties need to domesticate GBV policies, and that will mean that then resources are available. There was very, very strong feelings that, the only sustainable way of addressing GBV is getting government and county funding, to be committed to this end. Secondly, when it comes to donor funding is always welcome. We need to focus more on grassroots organizations. They seem to be left out in a lot of the funding opportunities. We also need to focus more on norms change interventions and survivor services. And like I saw, some of the viewers have asked, particularly mental health services. Those are really, scarce in our context. The third recommendation would be the need to strengthen the national GBV monitoring and evaluation systems. Data is everything. Without data, you will not convince a leader that there's a problem. And with data, then you can target and tailor your interventions because resources are always limited. Finally, maybe something that's very close to me, I think we need to comprehensively address the plight of girls affected by this pandemic. Counting them is not going to be enough. I do not have a perfect answer of how we shall do this, but we need to ask ourselves a few questions. Will the girls go back to school? How will they juggle school and taking care of their babies? And how do we redesign the school and home setting to accommodate their needs and help them achieve their academic goals? And how do we ensure that they get justice? I think if we collectively answer these questions, the girls will one day tell a story about how COVID-19 changed their lives and how they have overcome obstacles to achieve their dreams. I'm just hoping that all the stakeholders and the people that are working in the GBV and other, social protection sectors will begin to write a success story for these girls, when even as the schools reopen next month. Thank you.
Thank you all so much for your incredibly, for your dedication, your courage, your creativity in thinking about all of this. We believe the answers lie in complexity, and looking at things in a very detailed way and deconstructing what's going wrong. So thank you all. And I again thank Murugi and turn it over to her to close out.
Thank you, Terry. In closing, I wish to thank all the panelists. What an excellent discussion. I also thank all the members of the audience for joining us today. We appreciate you being here today with us. I have enjoyed this session. It really calls for some thoughtful way forward of what we need to do about these issues. And I hope you've enjoyed the session as well. Please be sure to look out for the recording of this webinar. The link will be shared with you via the email address that you used to register. Of course, as Terry said, we had several questions that we were not able to get to, and we'll see whether it's possible to get those questions answered and shared with the members of the audience who have registered. Otherwise, I thank you. I ask you to please look out for more Columbia Global Center webinars, and we look to having you participate in another episode the next time. So bye-bye for now.